Due to the graphic subject matter of today's video, viewer discretion is advised. Welcome back, everyone. I'm here back at the cabin recovering from my heart surgery. I'm 5 days out from my cardiac ablation surgery, and a lot of you guys have been really invested in the story over the years, and I wanted to give you an update as to how everything went. As you can see, I'm 5 days out and I'm doing really well. So let's talk about everything. To catch you guys up that haven't been familiar with my heart story, back in 2018, I was on a camping trip with my friend Birch. We were on a beautiful canoeing trip, having a wonderful time, when I experienced a heart emergency. So I was back at the camp after a lovely day of hiking and canoeing, and I bent down and stood up as I was trying to make a fire, and my heart rate started racing to 240 beats a minute. Now, this lasted over an hour. It was terrifying. We were trying to figure out what to do because we weren't really close to help at all. So basically, we tried lots of different things, and eventually after an hour, my heart rate went back to normal after I had a huge shot of one of those really sugary running pouches. So basically I had to spend the night in the bush freaking out that it would come back. My heart rate had gone back down after that to a more reasonable rate. And so, I don't know, it was fine. It never did come back that night, but I felt exhausted, like I was going to faint, had tunnel vision, all that kind of stuff. So eventually we evacuated me out of there the next day and got back, in the car and drove home. Got to see a cardiologist who suspected that I had something called supraventricular tachycardia, or SVT. So, started a battery of tests, including electrocardiograms and blood work and heart ultrasounds, only really to find nothing. Nothing really came up on my testing. So super frustrating, although we were very certain that I had SVT, given my age and, no other underlying health conditions. So the doctor had given me some options to start, pills to, prevent these attacks from happening, because they can happen in the future, or to consider a heart ablation where the tissue in my heart that's causing the abnormal beats to come from, that gets destroyed so it doesn't happen again. So, I went along for a while, was sort of thinking about my options, and, I had a couple more episodes, unfortunately. One that lasted another hour, some that lasted, just a few seconds, 30 seconds, 15 seconds. And then I had another one here at the cabin that lasted about 10 minutes after I was, bent down to look at the snowmobile, I kind of got stuck, so I was trying to get it out, stood up, and I had a huge episode and barely crawled back to the cabin to go and lay down. And actually I had another one after that. I was foraging for mushrooms, and I had another episode that lasted about, 5-10 minutes. So pretty scary stuff. So that kind of sealed the deal for me that I wanted to go ahead and get a heart surgery. So grab a seat. This is going to be a long video. I'm going to go into quite a bit of detail about the procedure itself and what happened. I think it's a pretty miraculous surgery, and performed by very skilled heart specialists. So if you're not into that kind of a video, feel free to go and watch any one of my other videos. I totally understand. But I think this video will help a lot of people that maybe have the same issue or a family member with this issue, and maybe you're a bit worried about the surgery. I just want to go over everything and the benefits of it and why I decided to get it. So after my diagnosis and my decision to get the heart ablation, of course, I was put on a list to get the surgery. Because I wasn't a critical patient per se, like I didn't have any episodes that led me to really faint, or it was ongoing and wouldn't stop, I was put on a list. So the decision to go ahead with the surgery happened, and the referral for the surgery happened in January 2020. I met the electrophysiologist, cardiologist, basically an electrician for your heart. And I met the electrician to talk about the plan. And basically we decided to go ahead with the surgery, and I was put on a list. Now the pandemic hit after that, so everything got sidelined. For a while. I didn't really hear much from them. I got calls every few months to make sure my symptoms hadn't changed and I was doing okay, because they were basically triaging who would get the surgery right away and who wouldn't. I got a call back in February 2021 that, we're a go ahead, we're going to do this in the next month or two. Then the third wave of COVID hit, and the ICUs were full where I was. My cardiologist was actually in the ICU treating patients with COVID with, terrible heart problems. So basically I was sidelined from the surgery. Then I got a call to have my surgery done in July. So let's take a look at some of the video I recorded in July when I got that call. So here I am getting my pre-op test. I did a COVID test, probably some blood work, and I'm ready to talk to the anesthetist. I don't think I can record during that, but I'm here at the hospital. It's pretty quiet here today. given the whole COVID situation. So we'll see. This will be a 2-hour appointment, and then it's go time. All right, so that went really well. So I couldn't really film in the hospital too much. I didn't want to, invade someone else's privacy or, things like that. So what happened during that consultation, so that was my pre-operative consultation. I had my blood work taken where they checked my blood sugar, my kidney, my liver values, and blood clotting tests, because I'll have some catheters put in. They want to make sure they aren't going to bleed. That is a risk, obviously, because one of the catheters to go into my heart, they put in the groin area, and I have to be really, really still once they remove it out for a few hours after so it doesn't bleed. So I want to make sure I don't have any kind of big problems before then. I spent a lot of time talking to the nurse, going over health history, drug allergies, any anesthetic problems that I've had before potentially, and she went over the procedure really thoroughly, so I kind of know what I'm getting into and if I have to go home on medication or have any rechecks or things like that. I spent a bit of time too with the anesthetist, kind of repetitive. Person asked me basically similar questions to the nurse, but they just want to make sure everything's going to be okay. Both of them listened to my heart and my lungs, got my height and my weight and my blood pressure and my heart rate, all that good stuff. So, and the COVID test I had to have there. I don't know if you guys have had to have one. This is my first one during this whole pandemic. Thankfully, I've not had to have one in the last 2 years. But man, that was awful. I don't know if you guys have had that done to you before, but the little Q-tip was up my nose and twisting around for like 10 seconds. Not fun. The nurse told me to hum to distract myself, but it was awful. I don't ever want to have to get that again. So that's all done. I now have to go into isolation for several days till my surgery because of COVID. You wouldn't really have to if it wasn't in the middle of a pandemic that we were getting the procedure done. So I'm just going to kind of hang around the house, just relax until my procedure. Well, I was super disappointed. The surgery didn't end up going ahead due to a nursing shortage, due to, some staffing issue within the department, COVID, not enough nurses, I have no idea. So I was super disappointed. So my next surgery date was the beginning of September. So I was super pumped. Let's take you now to the drive into the hospital where I debrief you guys as to how I was feeling. I'm on the road right now, going to get my ablation. So I don't find that I'm too nervous this morning. I think that was reserved for before. Watched a few YouTube videos about people's experiences with ablation, kind of like this one that you're watching now, and kind of put my mind at ease. So we're gonna head to the hospital right now. Wish me luck. So once I arrived at the hospital, I was brought to my room in the day unit area because it is day surgery. So here's my cool room, nice comfortable bed, had my heart monitors all behind me there. So I hung out there for a little bit, and when I laid down, I looked up and I could see this beautiful mural of a woman canoeing, and I thought, wow, there's a sign. Everything is going to go really well. That basically, how it happened. I had this attack when I was canoeing, and I have a picture pretty much like that of me that day. So I thought that was pretty cool. That was my room. And that morning, I had to have my blood work redrawn from July because it wasn't good. I couldn't keep any of that blood work from July. It was no longer, current. So they ran my blood work, ran it super quickly. The surgeon came down to talk to me, to talk about, the electrophysiologist, cardiology guy that I'd met back in January 2020. Went over all the pros and cons of the surgery, what the goals were for the day, how confident he was that we're going to fix this problem. Because essentially at this point, it was also a diagnostic surgery because they had never caught any of my episodes on their testing. Now, I have a really cool app that he told me to get on my phone, and a device called Cardia. And I actually had that with me at the cabin when I had a couple of episodes, and I recorded those episodes. So he actually got paperwork from me that day of those episodes and confirmed that, yes, it was indeed SVT like they thought, but they really had to kind of go in and take a look at what was going on. So I was happy that he confirmed what I said, because that was one thing I was a bit worried about, was that it wasn't actually what they thought it was. But that really cool Cardia cell phone app with the device was just literally a lifesaver in terms of, figuring out what was going on, at least ease my mind that I was going into a major surgery without, for a good reason. So we went over all those details with him and got consent for the surgery. And then I was wheeled down into the operating room went through all those, secret access doors that, you're not allowed in a hospital. It's pretty fun, actually, kind of going through the bowels of the hospital. And then the doors popped open and, I was in this literally like a beehive of activity. Lots of people, a few surgeries going on at the same time. It wasn't just me. There's a couple doctors working that day. But I had a team of approximately, I don't know, maybe 10 to 15 people working just on me. Kind of what I would guess. There was just so many people there. I met the anesthetist, the nurses. They all put me at ease, explained everything. I went into the surgery suite, which was huge. I don't know, maybe it was 20 by 20 feet. There's some glassed-in areas, a very large television on the table beside me. I don't know, 80 inches. It was huge. It would display all of my information, all of my live heart ultrasounds. Anything they needed to see was visible on that screen because not everybody, the room was huge, so they'd be able to sort of see what was going on. So when I was on the table there, I had my tubes put in my veins and my arteries, and also I had to wear electrocardiogram, the little wires and little pads all over my skin. And then that was around 8:30 in the morning. I had to get to the hospital for 6:30 when you guys first saw me recording that video. So 8:30 in the morning, here I am lying on the table, ready to roll. They gave me the happy drugs, and then I don't remember much after that. I woke up in the OR, actually. I think they were moving me onto my my bed to go back to my room. And I looked over at the clock, and it was about 12:15. So that tells you how long. I had a very long anesthetic there. The surgery itself, I think I read on my reports, you can read them online, was about 146 minutes, the actual surgery procedure itself, but I'm pretty sure the anesthetic was longer than that. So they were really happy. The doctor said they found what was wrong with me and they fixed it. So I was super happy about that. And we'll get into that in just a minute about how they diagnosed it. So I'm actually going to show you some of the footage, the video that he has of my heart and a photo of my heart ultrasound coming up. So continue on with this video to see that. So yeah, I basically got brought back to my room. I was pretty alert. My mouth was dry. My eyes were dry. I had an oxygen mask on. So I hung out there in the day area on bed rest for 6 hours. So they fed me. I had lunch. I had supper. Supper was actually pretty gross. You can see a picture of it right there. But I was thrilled to have anything in my stomach because I had been fasted for quite some time before the surgery. So when I woke up, how did I feel? Well, I did not feel very painful at all. I didn't feel any pain, actually, except the fact that I had to empty my bladder. They don't give you a catheter during the surgery, so you had to use the washroom when you woke up. So that was the only discomfort I had, but that was very short-lived. They have bandages because the surgery itself, a bunch of operating tools and instruments, basically they go up, they're fine little wires, I'm guessing, and they go up the legs in your veins. So in your femoral veins, that's where all of the instrumentation they need goes in there, like things to take images of your heart, needles, the radio frequency they use to get rid of the tissue in the heart that's causing the problem. All that goes through 2 incisions. Well, I had 2 incisions, one on the left and right side on my legs. So I had some bandages there. They had to be inspected very regularly by the nurse. They weren't painful. Honestly, at the time, they weren't painful. I did bleed a little bit. Like, you have to lay fairly flat. Your head has to be up just a smidgy in the bed, so you don't feel too sore with your back. But the reason why they don't want you sitting up or moving for about 6 hours is because of bleeding. So I was pretty worried I was going to have all these bleeding problems. I didn't. They weeped a little bit, but the nurse, put some pressure on the bandages and everything was fine. So yeah, that was the toughest part, is sort of sitting still for 6 hours. I didn't feel like I needed a nap. I think the medication I got for the surgery was a little bit stimulating for whatever reason to me. So I was quite awake just listening to what was going on in the unit. There's a few other people in there, another person getting a heart ablation, another person getting their pacemaker battery changed. So I don't know, it was just kind of like people watching for me for that 6 hours. Towards the end of the day, the surgeon came in to talk to me. He did 2 surgeries that day. I was the first one. So he came and told me he was super excited. They found out what the problem was and they fixed it with basically a 95+ chance that this first time was going to do the job. So what exactly did he find? Well, through all those instruments and all this technology, basically they imaged my heart, live in the surgery. They made my heart go at a certain rate and they watched the electrical flow of my heart. So here you can see a video of that. The surgeon gave me permission to film it. You can see here, there's my heart. The heart has 4 chambers, and what you can see here is the bottom of the heart. They kind of, remove for the sake of this video, so you can see what the problem was. And you can see that there's these little white lines, and that's a flow of electricity in my heart, is my understanding. I was in an electromagnetic field, basically. So when they made my heart go at a certain rate, they watched the electricity flow through it, and they noticed, I mean, there's a certain pathway that the electricity in your heart takes, and it's pretty standard. Well, what was happening in my heart was that it was actually going through an extra area, an extra pathway that was not supposed to be there. And so what was happening when I was having these episodes is that, the electricity was starting in the wrong part of my heart and going up from the bottom of my heart in the ventricles to the top of my heart in the atrium, he said. And that was causing this really, really high heart rate to happen periodically. And my heart was having a hard time snapping out of it because of all this extra flow of electricity coming from this pathway. So you can see in the little video that's been looping here, there is a red area there. And he said that is actually where the extra pathway called an accessory pathway was located. And we don't want the electricity to go through that way to trigger these episodes to be triggered. So what he did, you can see here in the video too, you wonder what that looks like a little tube going through my heart is. Well, that was actually, they come in through the right side of my heart with all the instrumentation through my legs. And basically that thing there had a needle in it to pierce through to the left side of my heart where the problem was, to deliver the instrument to destroy the muscle tissue that was conducting all that electricity. Yeah, I know, a little graphic. You were warned before. So basically, they used radio frequency waves to burn the muscle tissue where that abnormal electrical pathway existed. So you can see here these little balls that are on the image there. Those are actually little zaps from this really fine little, I don't know if it's a wire or what it is, but it delivers about a 3 millimeter burn area. And so he went along and cauterized, I guess is the word, those areas. And then after they tested again to see would the electricity follow through those areas after he had damaged the tissue, and it looked like they'd solved the issue by knocking out that pathway. So basically what I was diagnosed with, and hopefully I can remember this properly, was a left ventricular accessory pathway, and it was concealed. The word is concealed because the electricity went from the bottom of my heart to the top, not the other way around. So yeah, so left ventricular concealed accessory pathway. Blech, say that 10 times fast. So anyway, that's what the problem was. So they did not bother to do any further, any other kind of stimulating of my heart to get other pathways, he said. Because I asked him, I said, well, did you try to see if there's any other areas it came from? And I guess they decided in the surgery that it was too risky. If they did that, I'd run a risk of getting another rhythm problem called atrial fibrillation, which he says you don't want that. So it's not very good. And we don't want to give you another problem. So they decided at that point the surgery was finished. So, but he says, it was pretty obvious what the problem was right off the bat. He said, I found it right away. So he told me I was born with it. It's an error in my embryonic development that I had this pathway. It just never disappeared over time. It sort of hung around. It didn't cause problems until I was older, but there you go, problem solved. So after all that, the anesthetist came to see how I was doing, said goodbye, and I remained in the unit from about a full 12 hours, I'd say. They want to make sure you can walk around and that you can use the washroom before you leave, just so they know you're going to be okay. So how was my recovery? Well, the last several days, 2 days, the first 2 days you're on bed rest. You can't really do too much. You feel not too bad. I felt the anesthesia is the worst part of the recovery, to be honest. I really have very little chest pain, very minor twinging here and there. Sometimes if you accidentally overexert yourself, you can kind of feel a bit of pulling in the chest, and that's normal. I can take a little bit of Tylenol for that. I was sent home also with 2 months of blood thinners. I'm on medication called Eliquis twice a day. And that's to prevent blood clots from happening after the surgery. And yeah, 2 days of bed rest and then a week of not lifting over 10 pounds, taking it easy, walking on flat ground, not stressing yourself out too much. And then basically after that, you can go back to work. He told me that if, say, for example, you were in the military, and he does, military service people. And, if you're going to a country and you're, jumping out of a plane or doing something, he says, yeah, wait about a month. I wouldn't be doing that. But if you were, on a desk or something, probably back within a few days. But honestly, take the full week. It's worth it. For me, it's been about 5 days to fully come out of the anesthetic. The mouth dryness, the eye dryness, your stomach's a bit upset. You feel really tired. Sometimes I can take up to a week. So I've been taking it super easy, so it hasn't been too bad of a recovery. Just been taking it slow. My bandages, the bandages, just be careful. Don't lift too much because you don't want to bleed from your incisions. But honestly, I had very little. After I went home, there was really nothing. I changed my bandages on the second day. And then the third day, you're allowed to finally have a shower and you can take off the bandages at that point. So yeah, so it's pretty good. I'm really, really, really happy with the results of the surgery, as is the surgeon. That just means it's going to give me my quality of life back. So if you're sitting on the fence about getting the surgery, this is something they do all the time. The technology is amazing. And if they discuss the risk factors with you and you think it's time to go ahead, I would highly recommend the surgery. I wasn't very painful. Like I said, it was like, I didn't even realize I had a surgery. I kind of woke up and I felt pretty normal, other than just hazed from the anesthetic and just feeling a little, from that. Because it was a long anesthetic, it wasn't like, getting your tonsils out or something like that, or your wisdom teeth. So that's just something to consider. But honestly, I will go ahead and do it. It's going to give me my life back. About 2 months, my heart muscle will be fully healed. So I'll be able to go back and do what I love to do without all that worry, because certainly when you have a condition like SVT or even atrial fibrillation, which this surgery can, help to cure as well, it affects your life. Your heart rate's going like crazy, you feel faint, you're having trouble breathing. You don't want to be stuck in the wilderness like I was with this problem. So that's one of the reasons why I decided to go ahead with it. It was a huge quality of life change for me. And I live in Canada, so my this surgery was 100% covered by, the government, taxpayers. Thank you very much. So, because I think it's probably, I don't know, several thousands of dollars for this surgery. So I understand that not everybody may have access to that. So that might be a challenge, and medication may be what's best for you. But if you have access to the surgery and you can do it, I highly would recommend getting it done, especially if you're, you live an active lifestyle and maybe you're going places where you're unable to get help, like you're off grid a lot. So over the coming months, I'm going to carry my Cardia with me, my phone with my little EKG device there, just because, if there was to be something happening, my cardiologist wants to know. My next follow-up is in 4 to 5 months, where I'll wear what they call a Holter monitor. He said it's a 14-day EKG that I have to wear to see if they can pick up anything. Never picked up anything before, but I'm going to go for that test anyway, just because that's what they want to do to follow up. And I'm going to bring my Cardia with me everywhere, just in case I have some breakthrough. He said during the first few months, maybe not few months, first few weeks, possibly up to a couple months, you can have a little, runs of stuff. Like you start to feel like, oh, here we go again. But basically, they've burnt the heart muscle, and the heart muscle's a bit inflamed, a bit irritated. So not to be alarmed by that, what they're looking for is for it not to go into an hour-long episode. So you can have these little tiny runs. He said you're going to get nervous. You're going to feel this starting. You're going to be like so hyper aware of your heartbeat after the surgery, which I have been. You're going to be so hyper aware of it that you might get some anxiety with it. And he said that's going to happen even for years after. You're going to think, because it's been such an infrequent thing, you're going to think, oh my gosh, it's back. Here it is. And he said that you will feel that. It'll get better over time, because you'll realize that these little blips that you get, these little flutters in your chest, they don't actually go on to developing the full thing. So that's something to be aware of, that, post-op you can feel a little bit of these butterflies. And I felt them when I was there. I felt them now. But I don't go into these big, long, 240 beat a minute, for 5+ minutes, whatever. I don't go into that at all. It's just more like a blip, 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 and then it stops. So that is reassuring to me. And he said, don't worry, this is all part of the recovery process. Everybody goes through it. He treats people, 7, 8 years old, all the way up into, probably their 80s or whatever for this problem. So he's seen it all. He's heard it all. So it kind of reassured me that my recovery was going to be pretty smooth. He said if there is that, that is that small chance that they may not have gotten all the tissue. But he said that, there's no issue to go back in again. They know exactly where the area is, that there could have been a little bit of breakthrough, and they go back and touch that up. So I would definitely get the touch up. Obviously, if that had to happen, which I'm praying it does not have to happen. But if I would definitely go back and do it again. The surgery was actually a really positive experience. So I've just been at the cabin kind of recovering. Once I felt better to kind of get out here, I've been, out here recovering and just piddling around, playing with Royce. And, sometimes when I didn't feel, like going for a big walk or whatever, I just hopped on the tractor and we just went for a little drive, entertained him, and I got to kind of do my little forest walk without really stressing out my heart. So that's my story of my cardiac ablation for SVT. I hope this is helping some of you guys. I know I've watched quite a few videos on YouTube about the procedure itself and other people's experiences, just to kind of help me, through this time, because it is a bit stressful for sure. So I hope this video helps somebody out. I know it's pretty long, pretty detailed. So thanks for sticking around if you made it this far into the story. And hopefully this is it for me in terms of the surgeries, that I'll be all done, and hopefully nothing will reoccur. And of course, if you have any questions about the surgery, the procedure, anything, leave it down below in the comments. I'd be happy to answer the questions for you and to mentor you along this journey too, because I want to thank everybody who sent me well wishes, people that have mentored me through this process, that have had the surgery and have had a really successful surgery, and told me just to go for it. I really, 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 from the bottom of my heart, my little heart, thank you so much for all that. It meant a lot to me during that early recovery phase to get all those messages from you guys on Instagram and Facebook, and text messages from supporters, friends, followers. It means a lot to know that there's a lot of good energy out there supporting me through the recovery phase. Well, thanks so much for tuning in to my story today and following me along this journey over the past few years. And, I really appreciate you guys following my journey and enjoying my little videos on this channel. So we'll see you in the next video. I'm off to kind of explore the woods, a little bit slower pace for the next little while. Take care.